Now, starting with the posterior compartment structures, we're going to start off with the gluteal region and the gluteal muscle. So the first muscle that we reflect, covering the entire gluteal region, is the gluteus maximus. And then deep to that muscle, we've got the gluteus medius going all the way up to the iliac crest, and so it's cut here. Even deeper to that is the smaller and deeper gluteus minimus, which goes about 3/4 of the way up the iliac bone. Inferior to the gluteal muscles, we've got the piriformis running across above the sciatic nerve. So here's sciatic nerve. And then below the sciatic nerve, also deep to the sciatic nerve at this point, we've got the superior gemellus, the obturator internus, second muscle here, slightly more tendinous, and then the inferior gemellus. And then the fourth muscle in this region is the quadratus femoris. Making our way down to the posterior muscles, to the hamstring muscles, we can kind of follow the sciatic nerve descending here, and then it's going to emerge in between two of the major hamstring muscles. So biceps femoris and the two heads of that muscle on the lateral aspect of the posterior thigh, and then semitendinosus with a prominent tendon and semimembranosus, slightly more muscular, are going to be the medial muscles of the hamstring here. And we can see the sciatic nerve emerging in between the heads of those muscles. I also want to point out the tensor fasciae latae, which is this lateral tendinous sheath slash muscle that runs up and down the thigh, going all the way to insert on the tibia here, sometimes called the iliotibial tract or the iliotibial or IT band, which is actually considered one of the gluteal region muscles, but it certainly can be seen in the posterior thighs or the anterior thigh as well. Making our way to the knee, or the popliteal fossa, or popliteal region as we call this, we've got the splitting of the sciatic nerve into the common peroneal or common fibular, and the tibial nerve, which continues to descend through the leg. Right, so the common peroneal, which will then split off into superficial and deep branches as it enters the leg, and then the tibial going all the way down, innervating the posterior muscles. As far as the arteries and veins, we've got the popliteal vein and the popliteal artery. The vein is always on top of the artery. They're usually running side by side, and then at the popliteal fossa here, the vein shifts to go on top of the popliteal artery. We can also see some of the branches of the popliteal vessels here. So the posterior tibial artery and vein descending to give blood supply to the posterior compartment of the leg. We've got the fibular vessels, which split off to the side and give blood supply to the lateral muscles of the leg. And then we've got the anterior tibial, which goes through the membrane and the muscles in the leg and will eventually give blood supply to the anterior leg muscles. And that would probably be better seen on an anterior view. As far as the leg muscles, we've got the gastrocnemius, the large two-headed muscle here, which shares a tendon with the soleus. So the second muscle deep to the gastrocnemius is the soleus, and they're going to share the common calcaneal or sometimes Achilles tendon. If we reflect both of those muscles, which we were just looking at here, we can see some of the deeper muscles. The first one is plantaris, a very skinny, very slim, mostly tendinous muscle, slight bit of actual muscle fiber at the proximal bit here, and then mostly tendon thereafter. And then if we go even deeper, we can see some of the deep muscles of the leg here. So on the medial aspect, we've got the flexor digitorum longus, which is going to flex the digits or the toes. On the middle aspect here, we've got the tibialis posterior. And then on the lateral aspect here, we've got the flexor hallucis longus, which is going to flex only the great toe. So let's go over that one more time here. So we got flexor digitorum longus, tibialis posterior, and then flexor hallucis longus on the lateral aspect. Two of the lateral leg muscles here, fibularis longus and fibularis brevis, can also be appreciated on the lateral aspect. So fibularis longus and then fibularis brevis, slightly deeper to that.